Hi, I'm Brian Clark, physical therapist here at Helen Keller Hospital, the Wellness Center. What we're going to show you today is what we call a preoperative training for a total knee replacement. So pretty much we're just going to let you know what to expect with a knee replacement, what we're going to do before, during, after, just to kind of set your mind at ease a little bit, give you some information so that you don't go into it blindsided and you feel a little more comfortable with your surgery. So I've got a little model that I'll show you to kind of explain to you the surgery. This is the knee. Here's your patella. And so usually during the total knee replacement, what they will do is they will move the patella out of the way and they'll bend the knee back. Now this blue on here, that's the cartilage. Anyone that's needing a total knee replacement does not have that, and that's the reason you're having the surgery. So most folks think that they cut the knee out. Cut, and take this out, and that's not what they do at all. What they really do is they just shave just a small layer of bone off of that, and then they put a cap on it, similar to capping your teeth. They do it once on the top, and then they do it once on the bottom. Some people that have real bad arthritic changes in the knee, they will also do the underside of the kneecap as well. That's not quite is prevalent. You don't see that quite as often. So anyway, that's pretty much the surgery. So the main thing that we do is that our concern is after surgery. So once you come out of surgery, they'll have your knee in a large brace, or really it's more bandaged. So it's a lot bigger than what you're expecting your knee to be. Most of it's bandaging. The biggest concern that we get is with swelling. But we have very little complaints of too much pain right after surgery, because with all the anesthesia and all that, within a few hours, people still don't have a lot of feeling. So we will put your leg in what we call a CPM machine. It stands for continuous passive motion. And what that is it's just a machine that continuously just bends your knee and straightens it. Bends your knee and straightens it, and it does that over and over and over. And a lot of times when we put it on, you won't have feeling in there. Sometimes you won't even remember me coming in putting it on. Hopefully, if you have an early morning surgery, usually by about 2 or 3 o'clock, we can come in, start getting you up, moving you around. The main thing, we just want to get you off your back, get you moving. We don't want to risk any kind of blood clots or pneumonia or anything like that. And most people actually feel better when we come in to get them up. I get little complaints of a little nausea and some dizziness from some of the side effects of the anesthesia and the pain medicine and stuff. But really, pain-wise, most folks do pretty good. But there's always two of us holding on to you. I'm going to show you what we'll do with the walker. So we will try to stand up first day. Try to put a little weight through it, doing some weight shifting side to side, forward, backwards. Just trying to get a little weight on it. So the main thing to know is when you're walking, you use the walker, always put the surgery leg out first, then you put weight through it, and that way you can use your hands to help assist you. If your surgery leg is behind you, it may feel a little jello-like, especially after the anesthesia, and it might kind of buckle on you. So that's why there's two of us on either side, and we always put the surgery leg in front of you every time you go to take a step. Same thing, we might get you to walk side to side a little bit. Just like that. Nice, easy steps back and forth. So that's the first day. Most folks are in the hospital about 3 days, and by the time that third day rolls around, you're more than ready to be out and going. We'll have you in and out of bed a lot, doing a lot of exercises, bending the knee, straightening it, walking in the hallway. So really, by about 3 days, you're up and walking on it, putting pretty good weight on it. Maybe somebody kind of standing next to you, but you know, not really a whole lot of assistance. One thing I like to emphasize right after surgery, people with the knees, they have a problem straightening it. And the reason is there's so much swelling, a lot of pain, and also a lot of it's habit from kind of limping around on that knee for so long. So we really work on pushing that knee as flat down as you can, so that when you're walking, your legs are the same length. And that way you have a nice steady gait. After you leave the hospital, there's a lot of different options. You'll talk to your doctor or one of the caseworkers, social work at the hospital, and decide what's best for you. Some people will go home with home health therapy, where they have the nursing and the therapists come to the house. Some go to inpatient rehabilitation for a couple of weeks, and that's where you actually stay there and they work with you. And we have people that stay anywhere from 1 week to 3 weeks, whatever you need. And then we also have people that come straight to outpatient here to see us, and they'll have surgery, maybe on a Tuesday or Wednesday, they'll stay in the hospital 3 days, and by Monday they start coming to outpatient therapy and we start working with them.